Good morning, Dr. Ando, physical therapist, and this is Jackie Price, one of our dancers. We're going to be showing a demonstration of work we're doing on her foot to increase their mobility and also her dance function. Okay, so let's pan down here. So the line of her foot, she had problems with the toe. She had a big callus underneath the foot here that she actually lost about 3 months ago. The whole thing had to be removed, but she does develop a lot of calluses, so we had to take that off using a Dremel tool. And then what we're trying to do is get the line back to her toes. So Jack, if you can kind of point, and the line is pretty good there. We want to get that nice roundness across the top. There's a little bit of a drop here, and we're going to see if we can gain that for her. We want to make it look like this one. See how that nice line through the here, nice round, nice control through the toe, and when this is elevated in the air, it looks very graceful and very nice. Okay, so we're going to use these glider tools that we use to help with the soft tissue and the joint mobilization. The first thing we're going to do is put it underneath, and this is a kind of a typical treatment. And then we'll use a smaller glider to help with the soft tissues and the joints across through here. I'll use my other hand to move the toe where I want it to be. And is that a little uncomfortable?
Yes.
A little uncomfortable. If we did this on the other foot, the normal foot, how's that feel?
Feels much better.
Much better, not as quite as uncomfortable. So the discomfort that she feels during the treatment is actually indication that we're actually kind of doing the right thing. Okay, so based upon the mechanics of the foot, we're trying to get the transverse arch and the longitudinal arch, both of them being in a healthier state, which will allow her to have that line and be able to get her weight bearing inside and the outside equal and get her balance better. Nice soft tissue through here, like that. You can also use a little bit of gentle mobilizations through it. Okay, you can do a little bit of a squat for me. Good, so props that help the joints of the foot to regain their appropriate position. Okay, good, and then lift this up for me. And then the other thing that can happen too is that on dancers, a lot of times the back of the heel gets kind of locked up, so that they actually lose their ability to go into demi-point and point, and they'll get compression in the back. And so we can also use these tools or our hands to move the tissue back out of the way so that that point can happen. So that's been a little bit better too?
Yes, a
okay.
lot better.
Great. So pan back up. Okay, so after therapy, how's your dance been?
It has definitely improved a lot. Strength-wise, I feel when I jump, I can really push off the floor, and then flexibility-wise, I'm not getting the pain as much when I dance, and I'm getting more range of motion in my feet when I go up on releve, and when I point my feet, and when I do point work.
Okay, great. So we're very happy. We're not quite finished with her, but we thought we'd show a video of a typical treatment of a therapist doing comprehensive work to a foot, and this is Orange County on stage, the typical treatments, and Jackie will also be posting a video of her, and please take a look at that because she's a wonderful dancer. Bye now.